When we talk about coronavirus, we keep hearing this term social distancing. You heard Kaya reference it just a few minutes ago. But what does that mean, and why do doctors want us to practice this? That is the focus of our digital dive. You know, this post is getting hundreds of comments on our KARE 11 Facebook page. Social distancing basically means staying away from these large gatherings, congregate settings, and also staying about 6 feet or more away from people in general. This is all meant to slow the spread of the virus and what's called flattening the curve. So this graph from the CDC we've shown you before, this purple area right here shows a huge spike in coronavirus cases if there's no intervention at all. We don't want this outcome. This smaller curve right here, kind of in the shaded area, shows how a pandemic may spread if there are efforts to slow or stop it, meaning far fewer cases. So this is why large events are being canceled. Now I'll give you an example of why doctors say social distancing works. Remember the H1N1 swine flu pandemic in 2009? Well, researchers found that in Texas, when school districts closed there was a 45 to 72% reduction in acute respiratory illnesses in homes with school-aged children. So a big effect there in Texas, 11 years ago. So doctors are saying with the coronavirus, they're saying, look, this has worked in the past, social distancing, let's do it again.
Yeah, it was one of the words that came out of that phone call yesterday with health experts. And I think a lot of people were saying, especially teachers were saying, how do you do this with a class of 35 kids? But as we're seeing, a lot of schools are now closing.
And we have the ability to do e-learning now, so I'm
Right.
definitely going to take advantage of that. A lot of schools already have in some cases.